So, Dr. Alaina Taylor, thank you very much for joining The First Word. It's a pleasure to meet you for the first time today and to have a chat about everything you do.
Thanks so much for having me. It's a pleasure to speak to you as well.
So, you are a widely respected and experienced restorative plastic surgeon for women in Sydney. Reading about you is phenomenal. You've done so many years of training, you've travelled the world. And you specialise in restorative or reconstructive surgery for women who undergo mastectomies, breast augmentation, including reductions, lifts, implants, and a whole wide range of skin procedures. So I just would love to know what is your main area of interest and what pulled you, I guess you had to do all the sort of general surgeries and whatever else before, but what pulled you into this particular aspect of medicine?
Well, I guess my area of interest is generally aesthetic and reconstructive procedures of the breast, body, and face. So it is quite broad, but that is plastic surgery. I do like to focus on breast reconstruction, such as after cancer and congenital breast deformity, and other breast procedures like breast augmentation, reduction, lift. And that goes hand in hand with post-pregnancy procedures for women like abdominoplasty or tummy tuck and repair of the muscles.
Yeah.
And I also do eyelid surgery, face and neck lift, and skin cancer surgery, as you said. So as a plastic surgeon, our training is very, very broad. We learn to manage all kinds of conditions from the top of the head to the tip of the toes, and we work with skin, fat, muscle, tendon, nerve, you name it, all the tissues in the body in special areas. So to answer as to how I sort of got into plastic surgery and got involved, I think the variety and the breadth was one thing that definitely attracted me. I was definitely one of those kids who really had a sort of deep sense that I wanted to be a doctor and study medicine from a young age. And I used to sit there with the medical encyclopedia and kind of like just pick a spot and read it at night instead of watching TV or whatever, iPad. We didn't have them then. And then when I was a young teenager, I actually cut my hand by accident on a glass, and I cut my median nerve, which is a very important nerve in the hand. And I had it repaired by a plastic surgeon who had to use microsurgery to repair it.
Oh, wow.
And that's when I kind of got on to, wow, that would be so amazing to be a microsurgeon, to be able to restore form and function like that. And that's when the idea of plastic surgery came in. I was about 13. I continued along, went to medical school. And so pretty early on, I sort of focused myself on doing all the necessary things to be able to apply to surgical training as soon as possible. And then I got onto the general surgery program first and did 3 years of that, and then on to plastic surgery. So it is a long journey. But yeah, I had kind of the idea in mind quite early on, which is a bit weird, but
It's amazing. It's always
that was
brand
me.
new.
That was me. Yeah.
I think I was really excited to have this discussion with you because I think when people hear plastic surgery, especially nowadays, they have a very particular idea of what that might mean in superficial terms. But of course, as you said, it's all about, it can go so much deeper than that. And I myself had a really injured finger. I've had a lip issue when I was little, and, to have plastic surgery to just retain form and function is a pretty, wonderful thing. So it's not, of course, there is the superficial element, but there's so much more to it than that. So it's a really sort of exciting, I guess, area of medicine to explore with you. But I am so curious because body image is such a huge topic nowadays. I think social media has kind of, exaggerated how women perceive themselves from a physical point of view. So when talking to clients who sort of are at that younger age of maybe 18 to 25, and then women after they're having their babies and their physical form has changed due to that, how does body image come into the conversation? Is it something that they lead with, or has it changed the way you see the work you do? Or I would just love to know how the world of body image, how you feel about it.
Yeah, so definitely body image is central to the work that I do now.
Mm.
And definitely social media and societal influences completely influences people who come to see me, and they
Yeah.
often do lead with body image issues. And
Mm.
one thing that really upsets me is I hear the most negative things that women say about themselves in my rooms,
Mm.
and I sort of have a ban on it, and I say there's no negative talk about yourself in these rooms. It's really sad to hear some of the ways that people speak to themselves. But certainly with respect to the social media side of things, I mean, it was really emerging as I was a junior doctor, and it's just grown exponentially over the years. So it certainly does, influence the way that I manage my patients, and it influences society generally, and
Mm.
particularly my patients. And, I think as time's gone on, social media trends have become more persuasive and more pervasive. So it really highlights the need and puts a greater responsibility on me to discern with a patient whether or not they are influenced by a social media trend or just a societal trend, which can be very geographical. It's different in Sydney versus the Gold Coast versus other countries, or whether it's something very genuine that they need, and also that it's something that is appropriate for them, because some people might come with an idea of a surgery or a procedure, or have a perception that's not realistic or appropriate for them.
Mm.
So it definitely is part of the conversation, and there's a lot of education that has to go into the consultation with my patients, just actually educating them about whether this is appropriate, whether they're a suitable candidate. So the communication is absolutely key, and I always try to have a really open, honest discussion with my patients, and spend a lot of time building that sort of two-way communication, so that they know what I know what they're getting at, and they know that I understand them. It's key to that sort of consultation.
Yeah. And it's funny, I feel like the kindest way we can all be to each other is if someone we know and love wants to have something done or something changed physically about themselves, and we might say to them, "Oh, you're beautiful. You are the way. You are beautiful the way you are," etc. It
Mm,
is, of course, that's true, but it is to be kind is to understand that what someone wants for their individual selves and what might make them feel better, and therefore more self-confident, and lift their body image. It's really important that I guess we respect everyone's individual perspective about themselves and their bodies and how they see themselves. So I can imagine all the things you hear and see. So it must be quite, it must almost be like a counselling session most of the time when you have those initial consultations with women.
Yeah, it really can be. And it's also important, as a plastic surgeon, to identify somebody who might be at risk of having a mental health issue or a deterioration around the surgery, because surgery can be really challenging. It can be very emotional. And people really need to be in their best physical and emotional state to go ahead with surgery a lot of the time. And it is understandable that people do want to proceed with these procedures, and on social media they're seeing success stories. There's so much available information out there now, and they're exposed to so much. They're
Mm.
seeing before and afters, where the after is 12 months later, and they're not seeing what happened in between. So it's
Mm.
understandable that they do come and want to have these procedures done.
Mm.
Absolutely. But also just equally important to discern who has some other issues that might need to be explored, and whether or not they would benefit from speaking with another professional like a psychologist. I think it's really important as plastic surgeons that we're all across all of that and sensitive to it as well. Yeah.
So, for example, are you referring to things like body dysmorphia potentially?
Yeah, that's definitely an issue. I mean, the
Mm.
incidence of that is, probably not as high as just the average person with anxiety, so sort of some
Mm.
strong anxiety or self-esteem or body issues.
Mm.
But yes, and the latest medical board guidelines that have come out in the last year now require that we actually screen patients for body dysmorphic disorder if they're coming for a cosmetic surgical procedure.
Mm.
Now, that doesn't apply to procedures that have a medical sort of reason, or they're part of the Medicare benefits schedule. So a breast reduction, for example, in a patient with very large breasts, that doesn't really apply. But a breast augmentation, we need to screen them, and we have to detect people who might be at risk and have them further evaluated by a psychologist if they are. So that protects the patients as well, so it's a good thing that's become part of our guidelines now.
Yeah, absolutely. I'm so empathetic to every female because I feel like nowadays it is so hard to feel enough as a woman and beautiful and perfect. And not even that you have to be perfect, but, it's a really tough kind of world. And I think if someone feels as though the best decision for them might be to look into all of the amazing, things that you provide, and it does change their lives or change potentially their mental health for the better, then it is totally within their right to explore those kind of avenues.
Absolutely. And look, you don't have to be happy, happy, joy, joy to have plastic surgery and be like, I feel wonderful about myself. I'm just doing this because like you can feel like, yes, I'm doing this because I need to feel better about myself. And this part is really affecting me. Most of the women that come to see me have a functional issue as well as a cosmetic issue around their breasts. So it's not purely, it's very rarely purely cosmetic. I'm literally doing this to look better. And oftentimes when that's the case, it may be that that person has a feature that's not within what we consider to be an aesthetic norm.
Mm-hmm.
And so that's all, very reasonable. So you don't have to be happy, happy, joy, joy, but you do need to be, we all, the patients and myself, we need to be aware of any underlying sort of anxiety or depression or potential for a deterioration around the surgery, and just have a patient's support system and coping mechanisms sort of in place and ready to go so that they can go through that process as seamlessly as possible. Because as I said, it can be difficult. There's pain involved. There's medications involved. There can be a bit of a slump in the days after surgery where you feel a bit like down because of the medication wearing off and the pain. And I call it surgical regret. People feel a little like, what have I done? And so, yeah, you really need to have that support in place and be prepared for all of that. But you don't have to be the strongest, most confident person to begin with, because absolutely you wouldn't necessarily be in the office if you didn't have anything about you that was bothering you physically.
Do you find a lot of your patients, or is there a substantial amount of women who come to see you who have had children and then have struggled with their body image since, whether that be their tummy, whether that be their breasts? Is that a common discussion you have with women?
Yeah, absolutely. So after pregnancy, there's a lot of things that happen, as you would know. But with regard to breasts, women who've had pregnancies and or breastfed, you don't have to have had breastfed to have any issues. Commonly, their breasts might be deflated or have lost volume, or they might have drooped a little bit, just drop down a bit lower on the chest than they were previously. And so, that can be definitely a body image issue, but it can also be an issue with regard to being able to fit into bras, fit into clothes, wear the types of tops and clothes that they want to wear. And that can sound superficial, but, that's an everyday thing that you have to think
Yeah,
about. And as you
totally.
say, the pressure on women these days is enormous. And so I think that that's fairly valid.
Yeah.
But also they might have with breasts that are drooping. I hate that word. We say totic or ptosis. That's a medical term. It sounds much nicer.
Much nicer.
Yeah. With the droopy breast, women can have trouble with sweating and rashes and what have you in the skin underneath the fold.
Yeah.
So, as I say, there's often a component there that's not just purely cosmetic, it's functional as well.
Yeah.
And definitely with regard to the tummy, I mean, women respond differently and the results are often very genetic or related to how many babies you have. But yes, there's the loose skin and that often doesn't bounce back. Some women also have rectus divarication, so a widening of the rectus muscles, which are your six-pack muscles in the middle there, and it doesn't necessarily recover for everybody, and that can lead to problems with back pain, stress incontinence, and a weak core generally. So it can affect your ability to lift, and so these are really valid concerns, and it's twofold. There's that
Yeah.
effect on your appearance and your body image, but then there's the functional side as well.
Yeah, totally. Well, I've had two kids, and I think we can't look past that after you have the baby or babies, your life is very much, changed, of course, but
Mm.
it's also really natural and normal and to be expected in many cases to kind of mourn for what you had. And that can sometimes
Yeah.
be the body you had. And we all know that you
Mm.
might not get it back 100%, but it is certain parts of your body might make you feel attractive. They might make you feel more feminine. They might make you
Mm.
feel um, stronger in stronger
Mhm.
in yourself. And it's very normal, and I would say not superficial, to really miss those things and mourn for them, and to feel a
Mm.
little bit I don't know, just a bit low and down when you
Yeah.
see the drastic change, knowing that after you have babies, you do sort of sacrifice so much, but to sacrifice your body is a big one because
Mm.
women are very connected and very in tune with their body. Like our body is our temple, and when we have no control over the change of it,
Mm.
I think it's only fair to assume that a lot of women are going to look for ways to you know find what they had and find that confidence again. So I think having those open discussions and just knowing, or just having realistic expectations, as you said, like instead of just looking at
Mm.
before and after or what she might have had or the results, to have
Yeah.
that expectation and to have the chats about, what is involved, complications, anything to be aware of, consider it all. But I would hate for any woman to feel shy or embarrassed or ashamed or vain because she wanted to explore those options. And I think
Absolutely.
I think it's all too easy for society or particular, now that, feminism is such a strong part of media culture, which is amazing. I don't think that should ever dilute a woman's right to feel the best she possibly can in her own body.
Mm. There's so much judgment on women. You can't win. So you have to
No.
really do what is right for you. And I do hear a lot of women come in and they say that they might have mentioned to their patient, to their friends, that they've had or they're considering a procedure, and it might be something like a breast reduction, which is just such a functional medical procedure. I don't
Mm.
deem it cosmetic at all. But their friends and other women will comment, oh, why are you doing that? You don't need that. Your breasts aren't that big. I mean, if your own friends are judging you, that is just a really bad sign of a society that is still so critical of women. And I
Mm.
think that absolutely you should feel that it's your right to go and explore options to address issues that you have with your body for your own reasons. And also, we shouldn't be criticizing or judging women for doing that when, as a society, we are still so focused on appearance with regard to the value of women, and
Yeah.
until that changes, and it may never, certainly not in our lifetime, you can't judge women for pursuing improvement in their appearance because it makes them feel better, it makes them feel more valued in society.
Mm.
And that's just the sort of cold hard truth of it, really. We've
Yeah.
Society's created the standards, and women respond, and then there's also the criticism of that. So it's tough. It's really tough.
It is tough. And I guess, in preparation of talking to you, I was reading the latest Harper's Bazaar, which is
Mm.
all about the wellness boom. And there's many articles in there, obviously, about beauty and about anti-aging or pro-aging. When it comes to things like breast augmentations or skin procedures, do you classify them in that category of anti-aging or, pro-aging, whatever you want to call it? Does it come into that? Does it fall into that sector at all?
Look, I don't think that as plastic surgeons, I'm speaking for myself, but
Mm.
knowing my sort of cohort, I think that we think of it very much as a problem solving. This is the issue. This is the procedure that I can offer to correct that. We probably don't consider it part of an anti-aging sort of, in an anti-aging realm. I mean, our training is very sort of, yes, it's traditional and it's medically based, and it's
Yeah.
this is the anatomy, this is the sort of where it started, and this is the changes that have happened. For example, if you're talking about the face, and we know that age-related changes happen on a skin level, a fat level, a muscle level, and a bone level, what can I do to address those 4 levels to restore the appearance of this person's face, because they're seeking, rejuvenation and a more youthful appearance. We sort of break it down into that kind of, what's my solution? So we look at it as a problem-solving thing rather than a wellness, anti-aging kind of drive. But I think now with the obsession with aging that we have, definitely surgical procedures are becoming normalised and accepted as part of that process, along with, exercise, nutrition, supplements, and all kinds of, weird and wonderful things. I mean, our access to different modalities now is just unlimited. It's amazing.
Yeah, it's a wide world. I get so interested in the beauty and wellness world and reading the science behind it and the clinical trials behind it and the testing behind it. And, it is, I think for the generation 1 to above, sometimes it can be a little too much, and it's kind of like, oh, how ridiculous, it's blah, blah, blah. But there is genuine science here and genuine long-term studies, and it is quite phenomenal to look at how we have progressed in terms of formulations and what kind of procedures we can offer. So again, it is a legitimate part of the wellness boom, and these kinds of procedures that you offer in terms of skin and everything else. They are becoming so much more normalized, and they'll only sort of, I guess, expand and mature from here on in. So it is an amazing world to see the exponential changes every year and what comes available and the access we have. It must be so fascinating to be in your position and to have access to even all the medical trials and information.
Yeah, it's really interesting. And I think we do know so much more now about the process of aging on a molecular level. And so we can target, things on that level. We can target different proteins in the skin. We can target collagen and elastin, and we know how to trigger them to increase within the skin, for example, with topicals, with cosmeceuticals, or with radio frequency energy. And then, in addition to that, different types of prescriptive injectables, which we're not allowed to mention anymore or advertise. But these are all becoming more and more and more advanced, and they're a great adjunct to the surgeries that we do as well. And it's part of that sort of prevention. So ultimately the need for surgery is going to be decreased, I suppose. It's fascinating. And look, medicine's improved so much to the point that we can prevent a lot of early onset sort of illnesses just generally. We know more about nutrition. We know more about the effect of exercise. So, it's no wonder that it's a booming kind of industry. And it's fascinating. There's always something new to learn. There's always something new to read about, and you have to sort of go, oh, I'm going to do that, and maybe we should do this. And, you can't do everything, and you just have to kind of pull back sometimes, because it's constantly it's constantly challenging, it's constantly interesting. And that's the beauty of plastic surgery as a specialty. I really do think it's the best surgical specialty, because there's just so much scope, and it's just it's sort of got an unlimited kind of canvas to work with in terms of the body. It's great.
You must get such I guess satisfaction after helping women, especially after mastectomies, and refining their body, and that must just be quite an amazing relationship you form with those particular patients after they've gone through such a traumatic illness and seen their body changed in such a way.
Yeah, look, it's a real honour to be part of that journey with women, and I feel very fortunate to have been able to sort of pursue this career and have the training that allows me to be in a position to contribute positively in some way. Women who've gone through breast cancer are incredible, and they do go through so much, and we know that when they undergo breast reconstruction, it does improve their sort of quality of life outcomes. And so it's really good and important work, and it is very fulfilling. It does definitely sort of give you a sense of great sense of achievement and fulfillment in the job. So it's wonderful. And the surgery itself is improving all the time and technically getting better and better. And so we're able to deliver the sort of outcomes with improved rapid recovery, and it's all just becoming so much kind of more widely available as well. There's still a limitation to the availability of breast reconstructive procedures for women in regional areas. So that's something I've been really sort of interested in becoming involved in and focused on, and providing sort of reconstructive services up and down the coast of New South Wales, because it's difficult for women to access it outside of the major cities. So we need to work on that a little bit more. But we're getting there. That's great.
Just going back to your comment about not being able to advertise injectables, what does that mean? What do you now refer to it? Because I've noticed that anti-wrinkle is now, people don't really refer to Botox. Obviously, Botox is a brand, but it is commonly referred to now as anti-wrinkle. But what is the issue with injectables?
So the TGA has now just changed the sort of guidelines around advertising prescription medications. So certain injectables that might be treatments for treatments for wrinkles, or treatment for volumization. So we're talking about filler and neuromodulators. Then they're the ones that you use for treating fine lines and wrinkles. They are prescriptive medications, and so with any other prescription medication, just talking about brands and advertising it is, there's limitations on that. So they're just coming into line with all the other medications in that respect. And so what that means is, I suppose, you can't advertise basically a prescription medication. You can advertise, or you can describe the problem that you're able to treat, and then the patient can seek further information from you. And so again, it's all geared towards protecting the public. And I think the changes that have been made by the medical board with regard to advertising cosmetic surgery, and also now the TGA with regard to advertising prescription medications and injectables, is just really trying to provide some regulation to the industry, so that patients and potential clients are in the industry that's not so medical are protected, because there's a lot of misinformation out there. And again, through social media and the use of influencers and what have you, these very serious kind of medications or medical treatments can be advertised as something that's quick and easy and risk-free, and that's not appropriate. So patients need to be aware of the risks and understand the sort of seriousness of seeking cosmetic procedures.
I think that also, though, from a consumer point of view, does make it so much easier to navigate if we can just, instead of hearing the words and terms and very flippantly saying things like Botox or filler or whatever else, if we can identify a problem or an issue or, an imperfection we might see in our own eyes, a solution to that problem, rather than hear a word and very flippantly think, oh, I'll get that, without realizing the actuality of what they're heading into. So that makes complete sense, and probably makes people feel a little bit safer when approaching those kinds of things anyway.
Look, there are risks with all of with all cosmetic procedures, and sometimes there's this blurring of it, as you were mentioning, whether it's an anti-aging wellness kind of product versus there's a blurring of the line between anti-aging wellness and actually it's a medical treatment, and it's a procedure that carries risks, and not all patients will be and not all people will be able to undergo that. If they're on a medication or they have underlying conditions, these things need to be considered, whereas that's not necessarily, brought to the attention of people when it's being kind of discussed or mentioned in a story by an influencer, for example. And so it's really hard, for people to discern, oh, that's something I can go for, or that's something, I can't go for. And so, it's just bringing it back to, look, this is a medicine or this isn't a surgical procedure. It's not kind of, it's not a serum, or it's not a lip gloss, or, it's not a hair do. It's not something along those lines. It's kind of a lot more it carries a lot more risks.
Yeah, absolutely. I think if you are looking into anti-wrinkle, you do have to know that you're not booking to get your eyebrows waxed. There is a pretty hefty form. There's a doctor clearing the procedure to go ahead. You're with a qualified nurse. You know, it's not
Mhm.
you're not just going in to have your eyebrows waxed or your eyelashes
Exactly.
tinted or something like that.
Yeah.
So
Yeah.
going back to the mumville question, I
Yeah.
feel so many of us, we have our babies and we think, oh, we can't wait to get a breast lift, or we can't wait to get a implants, or, you know, because the boob thing is big when you have babies. You know, first of all, you know, they normally grow when you're pregnant, then they become
Mhm.
engorged, then you're feeding for however many children, if you can breastfeed and if you choose to. So again, there's a lot of flippant conversation about, oh, we'll just get a lift or something like this. But
Yeah.
what is important for women to know who are thinking about this, especially the women who are not done having kids and think that they might have more? What would you like? What should they know about these procedures?
Yeah, so I think the main thing to know, and you actually touched on it there anyway, is that our breasts change with with aging, with pregnancies, with weight gain and loss,
Mm.
and with hormonal changes. So it's a moving target, so to speak. They're changing all the time, and so ideally, if you're going to have surgery, if you can wait until you've finished having your family, then that's probably going to avoid you having more surgeries than you otherwise would. And so, yeah, there's this changing nature of the breast tissue, and we ideally want patients to not be planning any more children and be at their sort of target weight as well, because
Yeah.
that's how they're going to get the best result with the most longevity. So,
Mm.
I mean, you can do the surgery sort of, and then have a baby, but you just need to be aware that things might change, and you might be up for another operation to correct the changes that occurred, which is not a small thing. So I think that's really the main thing, just to be aware that your timing will influence your outcome,
Mm.
and also the longevity of your procedure
Yeah.
result.
I think time is such an important one there, because it's very easy to have a negative kind of thought process about your body when you've had a baby 3 or 6 or even 12 or 2 years ago, 12 months ago, or 2 years, because your body undergoes such drastic change. And I
Mm,
think we owe it to ourselves to be a little bit kinder and to just
yeah,
let our bodies be and just recover, because
yeah,
pregnancy and birth is such a massive thing for any human body
mm,
to undergo. And then to reassess when we are at a more normal weight or a more balanced hormonal place
exactly.
that ever
Yeah,
exists.
yeah. Yeah, and look, there's logistics to consider as well.
Yeah.
So it's not necessarily that easy to be recovering from surgery when you've got, a bubba or toddlers, and you're still
Yeah.
doing eating and changing nappies, and there's a lot to consider really. But yeah, I think 3 to 6 months post breastfeeding, when things have stabilized, is probably the earliest you would consider. But
Mm,
you're right, there's some changes that occur within the skin. The skin can change, for a year or 2 years afterwards, as you know.
mm,
And so that there's no harm in waiting.
mm.
And I think sometimes there's that urgency, and that's a really good time to go, okay, if I'm feeling urgent, that there's an urgency, that's probably when I need to go slow, because you don't want to rush into something and make a decision that's not sort of what you would make, when you weren't under pressure, or sort of under the duress of being in that postpartum period.
Absolutely.
Mm.
That the logistics aspect is such a good point. I know a girl who had she had a breast lift after her kids and they looked fantastic. But what I didn't know is that she had to have someone, basically move in for 6 weeks because there was
Mm.
no heavy lifting, and she had 3 children. So they're even
Mhm.
to lift a baby out of the cot, put them on the change table, every time that baby needed to be lifted, she needed a pair of hands around her
Mm.
to prevent any negative implications. So that's just
Yeah,
another part that women really do need to consider. Is that available to you? Are you happy to
yeah,
have someone in your space for that longevity of time,
yeah,
et cetera, et cetera? So there's a lot to think about.
yeah.
So to finish up, I know, because as we've spoken about, I feel like in this world there's a quick fix for everything. Everything's so accessible. So if people come to you and you can tell they're just feeling really shitty in their own skin, really low, really flat, and they're coming to you for a quick fix because they think a procedure might just change everything and lift that dark cloud. What is what is your advice there? How would you treat that? How would you navigate that conversation?
Yeah, look, it can be tricky sometimes, and some people will come in and literally say exactly what you've said. I'm feeling awful. I'm feeling terrible, and I just feel like this is what I need to do to feel better. And that's really a contraindication to going ahead with surgery at that time, because sadly, if you're feeling terrible and you're feeling sad and you're feeling awful, the surgical process isn't going to be easy for you. You know, it's going back to what we were talking about before. You really need to be in a sort of a strong mental and physical and emotional state. You don't have to be completely happy with your body, but the quick fix idea of surgery is it's a fallacy, really. There are some operations that have a better recovery profile and are very satisfying, and then there are the ones that are more complicated and complex. And so none of them really are a quick fix, and there is a commitment that goes into having surgery. So I think that these women need a lot of understanding and compassion. And first and foremost, I just try to encourage them to give themselves a break and then talk about what their support networks are like. And oftentimes when people are feeling like that, there's something else going on as well, and there might be a deficit in that area in their support system, or they may have had some other event that they're grieving as well. So yeah, that's where the counselling kind of session sort of starts to kick in, and you just have to be aware and sort of really encourage patients to take a step back, seek out as much information as they possibly can, and then get their support system in place, and give themselves time to prepare for the surgery and then time to recover. So sometimes women come and look, they've been thinking about having this procedure for many, many years, and they might have already seen a plastic surgeon before, and they come and they are like, let's do this. And they are more ready than somebody who is just considering it now because, they've just noticed this or that, or some event occurred and they felt bad, and therefore they're just on the beginning of the journey. So I just ascertain where they are on the journey, and we sort of do have a conversation about how they're, what their sort of support system is like and what their home situation is like, and usually it's a big let's give this some time, but I often refer patients or recommend a psychologist if they need it and they're not being treated already. We refer to a dietitian for nutritional support as well. So we don't say no, because that can be devastating to have your hopes up and I'm going to go and do this and it's going to make me feel better, and then to go to a surgeon and have them say absolutely not, you are not appropriate. So very important not to sort of devastate somebody in that moment, but we come up with a plan, like this is what we might do for you, but these are the things that we need to do to get you ready. Let's get you on a really good diet. Let's do some blood tests and make sure all your wound healing factors are okay and treat those. Let's send you off to a psychologist, and let's give you a little bit of time, get you walking, whatever the case may be. So it's really that holistic approach, which I think is so important. And I have a few things that my patients are just used to me saying, like do your exercise, do your walking, high protein diet, cut back on the sugars, and then we'll review them in 3 months or something like that. Yeah.
Well, it's such a pleasure to talk to you. I would consider myself a really strong feminist, but a part of that really believes that we do need to allow women to follow their own path and not judge anyone based on the decisions they make about their internal self or their external self. So I love having these open conversations and really acknowledging that this kind of, these kind of struggles or these kind of procedures are very much reality to some people. And so it's just been really fascinating to talk to you. And I hope everyone listening can, if they are someone who is in need, I hope they jump to your website, which I'll link. And I'm assuming a consult involves a conversation and just sort of everything you've just talked about. So even if people have curiosities, I would highly encourage them to come your way and to have those conversations and just explore, their options. And I assume based on your experience, you could really highlight something that they hadn't considered yet or looked into and help them in more ways than one. So thank you so much for sharing your experience, and congratulations on such a fabulous career to date. It's really, really wonderful reading everything you've done and all the places that you've been to study such incredible work. So thank you so much
Thank
for
you
your
so
time.
much. Yeah, no, thanks. It was lovely chatting to you as well. Really appreciate it.
Absolutely.
Thanks.